Hello, everybody, and welcome. This Nurse Eunice with Florida Training Academy, and today we're going to be discussing fall prevention in the elderly. And so, if this is your first time joining, go ahead and get pen, paper, take some notes, and we're going to get started in about 10 seconds. So let's go ahead and let's learn about fall prevention in the elderly. We'll get started soon. All right, so let's go ahead and begin. Number one, which of the following is a risk factor for falls in the elderly patients? Hey, Janvier. A, high levels of physical activity. B, adequate lighting in living spaces. C, use of multiple medications. Or D, regular participation in balanced exercises. Which is a risk factor for falls in elderly patients? Hi, Felix. Hi, Lynn. All right, we'll be revealing the answer in three, two, and if you chose C, the use of multiple medications, you are correct. So some of your elderly patients could take psychotropic drugs or drugs affecting the blood pressure, and those medications help to increase their chances of falling. So you always want to be mindful if your patient's taking medications, especially if they have dementia or blood pressure issues, those medicines put them at greater risk of having falls. Number two, team, what action should the nursing assistant take if they discover a patient lying on the floor after a fall? Is it A, leave the patient alone and inform the nursing supervisor immediately? B, assess for injuries and call for help? C, document the incident and continue with their assigned task? Or D, call the patient's family before notifying other staff members? Hey, Mayra. All right, I'm seeing some correct answers. Yes, John Vier. Yes, Felix. Yes, Estelle. You all are correct. The correct response is B. You never leave your resident because they can go into cardiac arrest. So you always want to stay there with them. And while you're, hey, are you okay? You're checking consciousness and injuries. And of course, you're going to call for help. Now, the difference depends on whether or not you're in a hospital or whether you're working in home care. Because if you're working in a hospital, well, then you're going to call for your nurse. You'll call, a code. But if you're in home care, you're going to have to call 911. So just based on where you are, never leave your patient, but do call for help while you are still with the patient. Number three, which environmental modification is recommended for fall prevention in the elderly? A, removing area rugs and clutter from living spaces. B, placing furniture close together to create clear pathways. C, keeping floors wet to prevent slipping. Or D, using dim lighting in hallways and staircases. All right, so home care, you're the CNA who's going to someone's home. What would you recommend? Yes, so many correct answers. Fanny, the Miller family, and Ofoki. I don't want to mispronounce your first name. You are correct. The correct response is going to be A. You're going to be removing those area rugs and clutter from living spaces. They're going to trip over those area rugs, and even though they don't like to move them, we still want to recommend that they do so. All right, number four, what is the importance of educating elderly patients about fall prevention? A, to discourage them from seeking medical assistance. B, to increase their fear of falling. C, to empower them with knowledge and strategies to prevent falls. And D, to promote dependence on nursing staff for mobility. This is an easy one. I expect everyone to get this one right. Let's see, let's see, let's see. Yes, Estelle. Yes, Lynn. Yes, Fanny. The correct response for this one is C as in cat. So you're going to empower them with the knowledge that they need to prevent those falls, such as, hey, Miss Eunice, before you get up, let's put on your shoes. Or Miss Eunice, let's go ahead and let you use your walker or your cane. Constant reminders, okay? All right, so the next one is going to be Number five, after a patient fall, what should nursing assistants include in their documentation? A, personal opinions about the patient's balance and coordination. B, irrelevant information unrelated to the fall incident. C, assumptions about the cause of the fall without factual evidence. Or D, detailed descriptions of any observed injuries and circumstances leading to the fall. And so many of you all have passed your CNA exams. I am so proud of you. And if you chose D, you are absolutely correct. So, in your detailed response, it needs to be factual. So, you can talk about the injuries, go ahead and document the blood pressure or the vital signs, not just the blood pressure. You need a full set of vital signs. And you also want to document that you notified the nurse and that the nurse actually assisted you to get this patient back to the bed. So, at some point, you have to also document who you notified and what was that outcome. So your school, excuse me, your schools or your facilities should also teach you documentation, which is very important. Number six, what should nursing assistants prioritize when assisting elderly patients with ambulation? Ambulation is another way of saying walking. So, what do you want to prioritize? A, rushing patients to walk quickly to save time. B, using proper assistive devices and techniques. C, avoiding interaction and conversations with patients. Or D, minimizing supervision during the ambulation. What is your priority when you're getting Miss Eunice up and you're taking her for a walk? Thank you, Miller family. Thank you, Felix. Yes, yes. Make sure we're using those proper assistive devices. And normally, physical therapy will assign or will prescribe the devices that the patient needs. And so it could be a cane, it could be a walker, it could be crutches, or it could be an actual wheelchair. But you want to utilize whatever was prescribed to them and remind them to use it too. Number seven, which action is recommended for nursing assistants to prevent falls during patient transfers? A, encouraging patients to assist with transfers independently. B, transferring patients quickly to save time. C, avoiding communication with patients during the transfers. Or D, using transfer belts or gait belts for support. All right. You're moving your patient from one area to another. What do you want to recommend to prevent a fall? You all, I am trying my hardest to get some hard questions because you all have been answering all these questions correctly. I'm very proud of you, but next it's just time for you all to go to nursing school. I cannot think of another hard CNA question to give you. Number eight, what is the significance of regular vision assessments in fall prevention for elderly patients? A, to increase the cost of healthcare services. B, to promote unnecessary medical interventions. C, to identify visual impairments that may contribute to falls. Or D, to discourage patients from seeking assistance. Regular vision assessments. Yep, and I see the correct answers. You all are absolutely correct. They should have annual vision checks or more frequently if they have glaucoma or cataracts. That's going to help identify issues that can cause depth perception. That's when they start missing stairs because they're thinking that the step is closer than it really is, and also their peripheral vision. They can start walking into things, and that's going to contribute to falls if their vision is impaired. Number nine, when assisting a patient with mobility, what should the nursing assistant prioritize? A, moving the patient quickly. B, using proper body mechanics. C, ignoring the patient's discomfort. Or D, completing other tasks simultaneously to save time. Now, we know you're going to do D, but that's not the right answer. What is the right answer for patient safety? Yes, Estelle. Yes, Felix. Yes, Miller family. Yes, Lynn, Mayra, and Fanny. You all have the correct answer, which is B. Proper body mechanics. You all don't hurt yourself. If you're trying to improperly lift patients, or if you're doing it too fast, or you're lifting someone who's heavier than you're going to hurt yourself. And then, worse, a patient could actually fall on you and injure you as well. So, we do team lifts or we use Hoyer lifts. Don't try to move these patients by yourselves, because your back is important and we want to keep you healthy for as long as possible. Number 10, how can nursing assistants provide emotional support to patients who've experienced a fall? So let me go back and reread that. How can nursing assistants provide emotional support to a patient who has experienced a fall? Is it A, offering reassurance and empathetic listening to address the patient's concerns? B, ignoring the patient's emotional state to focus solely on physical care? C, minimizing interaction with the patient to avoid uncomfortable conversations? Or D, encouraging the patient to forget about the fall and move on? Yes, imagine how scary it is if you attempted to get a patient up and that patient fell, and now you have to go back and reattempt it. You're going to have to reassure that patient, and the patient is going to be rightfully apprehensive. And so you're going to be empathetic and you're going to listen, and it may take a while for you to build that trust again with your patient. So just be patient, and when necessary, instead of you trying to move that patient by yourself, have the nurse in the room also, or another CNA, just for comfort, so that patient feels more safe whenever they're getting up. And there's the response. The correct response was A. Number 11, when assisting a patient with bathing, what should the nursing assistant do to maintain safety? And remember, when you take your CNA exam, it's not based on a hospital. Whenever you're taking your CNA exam, you could be taking care of someone in a home care setting, a nursing home, or a hospital. So, whenever you are bathing someone, do you want to leave the patient unattended for a brief period? Use non slip mats in the bathing area, rush through the process to save time, or ignore the patient's preference for the water temperature? Yes, 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 a lot of bees. So you all are going to use those non-slip mats in the bathing or in the tub, and that's going to help to prevent falls. Number 12, which strategy can nursing assistants implement to promote safety during mealtime for elderly patients at risk of falls? A, allowing patients to eat in bed to reduce the need for movement. B, encouraging patients to eat quickly to minimize time spent sitting. C, use geriatric chairs with armrests for additional support. Or D, supervising patients during meals to prevent choking incidents. How do you prevent falls? I see a lot of B's. I finally saw the correct answer. Great job, Felix. Great job, Estelle. So, for you all, and this is a new term for you, it's going to be the geriatric chair. We call it a geri chair. And so it's like a huge recliner. Some of them actually have a tray table that can go across the lap, but this is going to be used to help keep your patients safe. They won't fall out of the chair. It has the armrest, and again, they can elevate their legs and you can put the tray table across it. So this is a chair that provides more support and stability, especially for your patients during meal times. Number 13, why is it important for nursing assistants to encourage hydration in elderly patients as part of fall prevention? A, hydration has no impact on fall risk in elderly patients. B, dehydration can lead to dizziness and weakness, increasing fall risk. C, encouraging hydration increases the likelihood of incontinence, thus reducing falls. Or D, elderly patients should avoid drinking fluids to prevent frequent bathroom visits. Why are you monitoring their hydration status? Catherine, the Miller family, Estelle. If you chose, let me go back. Oh, so I see the correct answers now. So if you chose B, and you chose that dehydration can lead to dizziness and weakness, you chose the correct response. I want to make sure I said that one correctly. Yes. So make sure that they have adequate hydration, even though it may mean they have to go to the bathroom more frequently. I'd rather them go to the bathroom more frequently than have them, one, get a UTI, urinary tract infection, from not going to the restroom, or two, becoming so dehydrated until they become weak and dizzy. Plus, on top of that, the heart cardiac output would also be decreased. So they need adequate fluids in order to keep those blood pressures up. Number 14, what is the significance of assessing footwear for elderly patients in fall prevention? A, footwear has no impact. B, ill fitting or inappropriate footwear can increase the risk of falls. C, elderly patients should not wear shoes to reduce the risk of falls. Or D, any type of footwear is suitable for elderly patients to wear. All right, what do you think the correct response is for this one? Felix, Estelle, Queen VP. I see you. I see you. I'm proud of you. And you all have chosen the correct response. It is B, ill fitting or inappropriate footwear, such as high heels. Oh, my granny still wears high heels. My granny is 86 with fire red hair, and she still wears high heels. And we can't, how do you stop Granny from wearing her heels? But she's not in the hospital. All right, so you don't want them wearing inappropriate shoes. You're responsible for them, so you want to assess them for the recommended non-slip type of shoes. Make sure it has some grip on the bottom, and if they are having on socks, you should put on the hospital socks. And the hospital socks have the slippy, or excuse me, the grids on the top and the bottom, and that's going to make them less likely to slide. And now I'll work on my granny. Number 15, how can nursing assistants promote environmental safety in the home to prevent falls in elderly patients? A, leaving electrical cords and clutter on the floor. B, placing area rugs in high traffic areas without securing them. C, keeping floors wet to reduce friction and prevent slippage. Or D, encouraging the family to install grab bars and handrails in the bathrooms and staircases or stairways. We're trying to prevent these falls. And this is a pretty inexpensive fix to prevent a fall. Yes, yes, yes. So everyone who chose D, look, you can order a handrail from Amazon for like $20. Some of them even have handrails that you don't have to mount. But installing those grab balls and handrails in the bathrooms, it helps to provide extra support for the elderly patients. It gives them something to pull up on, and it's just going to increase their mobility and decrease their risk of falls. Number 16, which approach should nursing assistants take when assisting with toileting for elderly patients at risk of falls? A, rushing patients to finish quickly. B, using assisted devices such as raised toilets or commodes. C, encouraging patients to use the bathroom independently without supervision. Or D, avoiding communication with patients during toileting. I see some D's, but D's not the correct response. Amita has it. Catherine has it. Cartoons has it. It is B. So, you all, this is a raised toilet. It is literally a seat and with handles that goes on top of the toilet. Pretty inexpensive. And you all, most of your if the family or the patient lets the doctor know that they need these assistive devices, it's actually covered by their insurance. So we just need someone to communicate what the patient's needs are, and they will get a medical company to come out and deliver these type of devices. So raised toilet seats makes it easier for them to get on and off of the toilet. Number 17, what is the importance of regular exercise programs for fall prevention in elderly patients? Exercise programs have no impact. B, regular exercise helps to improve strength and balance and mobility. C, elderly patients should avoid exercise to prevent injuries. Or D, exercise programs increase the risk of falls in elderly patients. Now, do you want grandma in bed all day? Or do you want her moving around? Looks like totally not frown. Felix, Catherine, hello, 621. You all have it. Yes, great job. We need them moving. And so passive range of motion, let's say you have somebody who had a stroke. If you're moving the extremity up and down, that's called passive range of motion. So you could move the affected extremity and have them do the same thing with the other extremity. So, Ms. Jenkins, every time I move your left arm, I want you to move your right arm. And that's going to help keep them exercising. And again, if she can touch her hair or her head, she should be actually styling her hair. If she touches her face, she should be cleaning her face, because the more you keep them moving, the less likely they are to get blood clots, and the more likely they are to improve their strength, their balance, and their mobility. So we're going to keep them as independent as possible for as long as possible. Let's keep Miss Jenkins moving in that room. Number 18, how can nursing assistants assist with the modification of home environments to prevent falls in elderly patients? A, ignoring environmental hazards to avoid confrontation with patients. B, refusing to provide assistance with environmental modifications. C, collaborating with patients and family to identify and address hazards. D, minimizing interaction with the patients during the home visits. Yes, because I've already come in that home and I've done my assessment, and I've told Miss Jenkins to move that carpet, and she moved it when I was there, but she put it back down. And so now you're there. So you're going to have to follow up, and you're going to collaborate with the patients and the families to identify and address the hazards, which are more than likely those rugs or cluttered living areas. All right, we want to keep the patient safe. 19, when a patient falls, what is the first action a nursing assistant should take? Is it A, administer first aid immediately? B, call for assistance and assess the patient for injuries? C, document the incident without delay? Or D, inform the patient's family before notifying the other staff? Hmm, what do we do? What do we do? Patients on the floor. Ayana, Amita, Fanny, Catherine, Miller fam, and yes, you're going to get some help. You're going to call for assistance, and then you can start assessing the patient's injuries. So the immediate priority after patient falls is first to ensure the patient's safety and assess them for injuries, but you also need to call for help. For example, if you call for help and don't assess their injuries, what if they have a laceration where they're bleeding? Are you just going to let your patient lay on the floor and bleed while you call 911 or call for the nurse? No. So it's kind of like you're doing two things at once. If you have your cell phone and home care, you're calling 911 and applying pressure. If you're in the hospital, you're screaming out help. You're pressing the emergency cord, and at the same time you're applying pressure. So you are capable of doing two things at once, but you do want to actually assess them, and on top of assessing them, call for help. You all, I just want to say thank you. So at the last check, we have 498,635 subscribers. So by tomorrow, or at least the end of the day tomorrow, we should have 500,000 subscribers. So thank you all so much. I appreciate you all. And we start doing our NCLEX prep soon. So we just have so much in store for you all. And I just want to say thank you and that I love you. All right, back to business. Number 20, after a patient fall, what information is essential for the nursing assistant to document? A, details of the patient's medical history. B, the names of all staff present at the time of the fall. C, the circumstances leading up to the fall and any observed injuries. Or D, personal opinions about the patient's balance and coordination. So this is a piggyback off of the other question, but it's worded differently. And yes, Ayana, Myra, Jackie, yes, everybody, the circumstances leading up to the fall. Great job. Number 21, what is a common risk associated with lifting or moving a falling patient without proper equipment or assistance? A, reduced risk of further injury to the patient. B, increased risk of back strain or injury to the nursing assistant. C, quicker resolution of the situation. Or D, decreased likelihood of requiring additional medical attention. Very smart, guys. It is B. So I want to tell you a story. There was a CNA. She was probably 5'1", 120 pounds, and she was walking a patient who was 6 feet, probably about 200 pounds, and she tried to break his fall. And he ended up falling on her. She fell backwards, and the patient fell on top of her. She broke both of her kneecaps. So if you have a patient who is unsteady, and they've fallen or they're about to fall, you want to talk to your nurses, your staff, your physical therapist about ways to maybe break a patient's fall without injuring yourself. And that was really unfortunate, but she was out of work for a while, and so we don't want that happening to you. Number 22, after assisting a fallen patient, I think we just did this one. Let me just reread it. After assisting a fallen patient, what should a nursing assistant encourage the patient to do? All right, so do you want them to resume their normal activities immediately? Do you want them to stay in bed and avoid movement to prevent additional falls? Do you want them to request assistance whenever they need to move or perform activities? Or do you want to avoid reporting the fall to the healthcare providers to prevent embarrassment? Your patient has fallen. Yes, it is C. Yes, give them that call bell. Some facilities are going to have a pad that you put beneath them to where every time they shift their weight, it will alarm. So we call that a bed alarm. And that's going to, alert others when this patient's trying to get out the room. But they shouldn't get out of the bed without help once they are a fall risk. Number 23, what is the purpose of conducting a post fall assessment for a patient? A, to assign blame for the fall. B, to identify factors contributing to the fall and implement preventive measures. C, to avoid reporting the incident to avoid liability. Or D, to minimize documentation and paperwork for staff. Very good, team. Correct response is B. And so, in all of my years of nursing, I only had one patient who failed. And unfortunately, he was the father of an administrator in the hospital. And the physical therapist left the bed elevated, and the patient was a fall risk. So the patient climbed over the rails, hit the ground. Blood was everywhere. He pulled out his catheter. And so no one got in trouble. The patient ended up being fine after, a few days. But it's really important when we tell you things like leave the bed in the lowest position, put the call bell in their hand. It's really important. Those are preventative measures. That patient didn't have to fall, but the physical therapist, for whatever reason, just forgot to lower the bed that one time. And that one time is all it took for that patient to have an injury. So learn from us and keep those beds low, call bells within reach. And if there are any other assistive devices, such as the bells or the pads, make sure you actually utilize them. Number 24, how can nursing assistants contribute to fall prevention efforts in a healthcare setting after a fall? A, avoid discussions about fall prevention. B, reporting any observed hazards or concerns to appropriate staff members. C, blaming the patient for the fall to avoid accountability. Or D, minimizing interaction with the patient to reduce the risk of falls. This one should be an easy one for you all. We're part of a team. What do you want to do? Hi, Rose Blessing. Yes, Janelle. Yes, Amita. Yes, cartoons. We're going to report it. Yes. Again, it's not about getting in trouble. It's about keeping that patient safe. So you want to report any hazards or concerns to the appropriate staff right away. And number 25, you all, what is the significance of regular exercise programs for fall prevention in elderly? Is it A, regular exercise helps to improve strength, balance, and mobility? B, exercise programs have no impact? And this question is a duplicate. Wonk, wonk, wonk. C, elderly patients should avoid exercise to prevent injuries? Or D, exercise programs increase the risk of falls? And we know you know this one because I already gave you the answer. And so for this one, if you chose A, exercise helps to improve strength, balance, and mobility. You are correct. And you all, I will be back on here tomorrow. But before I leave today, I need a huge favor from you all. If you haven't already subscribed, please subscribe to our channel. We're so close to 500,000 subscribers, but I need to know what video you want me to create for tomorrow. So, what type of questions do you want me to create overnight so that I can come back on here tomorrow with the best test that you want me to create? So, any suggestions? I'm looking in the comments now. What test do you want me to create for tomorrow? What would you like to see tomorrow? Okay, Rose, go ahead and ask your questions, dear. All right. Hi, Azelle from California. Totally not frown. Hi. I see a lot of highs, but dementia. Rose says dementia. Okay. Vocabulary cartoons. Okay, I can get that. The role of the nursing assistant. Oh, wow. You're going to keep me busy this week. And then one more. I'm going to write them down. Hi, Renew from New York. Oxygen therapy. Okay. All those are great. Let me write them down. So, vocabulary, dementia. Oh my God, you all have a lot. Karen, for nutritional and IV therapy, this one is for CNAs, but I'll do that for the nursing. And I just want to make sure I got everything. We got O2 therapy, and then I think that's it, everybody. So tomorrow, my goal is to be back on here at about 6 p.m. and I'll try to come on weekly this week and get these questions for you all. I do appreciate you all. This is Nurse Eunice signing out, and I wish you much success on your test. I pray for you, and I hope that you all have a blessed night, and I'll see you tomorrow for another video. Good night, everybody.